Hi, my name is Ryan Loveland, and my DMP project is Post-Hospital Discharge Satisfaction Project for the guardians of pediatric postoperative patients who received either a telephone or video phone follow-up from the surgical services at Cincinnati Children's Hospital Medical Center at Liberty, Ohio. Cincinnati Children's Hospital Medical Center, or CCHMC, or Children's, in 2015 expanded their satellite campus at Liberty, Ohio to accommodate the growing need for surgical services along with their medical surgical inpatient capacity. The surgical inpatients are managed by Advanced Practice Providers, or APPs, who staff this unit 24 hours a day, 7 days a week, 365 days a year. The APPs manage patients from 6 different surgical divisions, including general surgery, gynecology, orthopedics, otolaryngology, plastic surgery, and urology. To help improve the patients' and families' overall experience at Liberty in 2015, it was decided by management that a one-day post-discharge follow-up telephone call would be performed by the APPs. The APPs assess for common immediate post-operative complications, pain control, and answer any questions from the guardians. This became part of our standard workflow. At the beginning of 2016, the choice of video phone, audio-video follow-up was given to the guardians of our post-operative patients, in addition to the established telephone follow-up option. After this post-discharge follow-up call, either through telephone or video phone, occurs, my quality improvement project will begin. The aim of this project is to identify and measure the perceived satisfaction from the guardians of postoperative pediatric inpatients from Cincinnati Children's Liberty campus. A Likert-type model questionnaire will attempt to measure the satisfaction between the tools used, either telephone or video phone, after the one-day post-discharge follow-up call occurred. The goal is to collect the data from the survey, analyze it through statistical methods, interpret it, and then present that information to children's management and surgical staff for informed decision-making ability to possibly modify, expand, or reduce the video phone follow-up program. Patient and guardians' anonymous demographics will also be measured, analyzed, and interpreted. Additionally, the program, questionnaire, and data obtained will be disseminated to the UC College of Nursing DMP stakeholders, and a written manuscript will be submitted for possible publication through scientific journals. Arguably, the world, technology, and healthcare are changing at a faster rate than ever before, and organizations must adapt to these changes. During the past 2 decades, the hospital length of stay for postoperative patients have decreased drastically. For many surgeries, the average length of stay in a hospital has decreased by half or more. Shifting the burden of care from hospital to home is physically and emotionally draining for family members. As we transition from a fee-for-service reimbursement model to a value-based payment model, the medical communities are being required to implement evidence-based practices, technologies, and other advancements in order to reduce the cost of healthcare while increasing the quality of care provided. If these things are not implemented, then the medical field will not be reimbursed for their services once the Affordable Care Act is fully implemented. Substantial emphasis is given to the perceived satisfaction of patients and families. 30% of adult inpatient reimbursements are tied directly to the satisfaction scores received from surveys, and pediatrics will be in the same situation in the near future. These are difficult tasks being asked upon the healthcare industry. Evidence-based practice and quality improvement projects are pivotal to specifically identify appropriate methods and programs to improve patient outcomes and satisfactions within organizations. With the help of other quality improvement projects and pilot programs, our organization decided that video phone follow-up would be one method to increase postoperative satisfaction. The literature also suggests that video phone follow-up can decrease physical, emotional, and anxiety-provoking stressors within postoperative pediatric patients and families. A technical report entitled Telemedicine, Pediatric Applications was published in 2015 by the Pediatrics Journal, where they did not identify any single framework to build and sustain a successful telehealth program. They did, however, recommend a 5-step process. First, ensure that the organization's leaders agree and are involved in the project oversight. Second, the organization's information technology support staff must be involved. Third, clinical champions must be identified and supported. Fourth, specific goals must be agreed on by all. And finally, periodic evaluations and reviews to measure effectiveness and process involvement are important. Since the first 4 steps have been previously implemented, I am focusing on questionably the most important step, the evaluation and review of this video phone follow-up program. The grand theory that has helped guide this quality improvement project is Virginia Henderson's need theory. It addresses the necessity to help nurses and inpatients so that they can care for themselves when they leave the healthcare facility. The theory addresses 4 major concepts: the individual, the environment, health, and nursing. Dr. Henderson said, as a patient receives treatment and is on the road to recovery, it's important that the patient is able to take care of him or herself after being released from the medical care. To that end, nurses should be caring for the patient while at the same time be helping the patient become more independent and reach goals and milestones on the road to health. The needs theory helps nurses assist patients' care for themselves when they leave the healthcare facility. All 14 components in the needs theory are required for effective postoperative recovery, but number 10, communicate with others in expressing emotions, needs, fears, and opinions, helped guide my project. The major concepts of this theory apply to postoperative healing because the recovery and healing process requires a holistic approach for maximum healing. More specifically, the patient-family-centered Kolkaba's theory of comfort provided me with the theory and framework by which I plan to positively impact the postoperative outcomes and satisfactions from our pediatric patients. In this theory, there are 3 types of comforts, but I'll focus on the first 2 for this project. Dr. Kolkaba defined comfort as relief, the state of having a specific comfort needs met, and ease, the state of calm or contentment. She also noted, when comfort interventions are delivered consistently over time, they are correlated with a trend towards an increased desire for health-seeking behaviors, and with improved institutional outcomes. She went on to explain some of the beliefs of this theory when she said, when patients and family engage in health-seeking behaviors more fully, the institution benefits in such areas as reduced costs of care and length of stay, increased patient satisfaction, enhanced financial stability, more positive publicity, improved access, decreased morbidity and readmission rates, and increased efficiency of services, and so forth. This theory provides me with the foundation necessary to achieve the goals of my quality improvement project, an ultimate goal of providing better pediatric postoperative care and follow-up with increased patient satisfaction and decreased healthcare costs. My PCOT question is, for postoperative inpatients and families discharged from Children's Liberty Campus, will the use of video phone compared to traditional telephone follow-up increase the guardian's satisfaction using the anonymous web-based questionnaire over the course of 3 months? Bryson, Patton, and Bowman in 2011 identified a 5-step approach for evaluation design with stakeholders. This telemedicine project evaluation was developed based on that model. The first step is evaluation planning. This is where the context, scope, budget, and clarity of the evaluation questions are developed. A literature review and discussions were conducted with APPs, patients' family members, and children's management to achieve these concept goals. Additionally, it was ascertained that the satisfaction evaluation would only assess the tool or method used for follow-up, and the evaluation of the providers or status of the patient would not be conducted at this time. The second step is evaluation design. This step includes identifying evidence-based methods and measurements. 5 different healthcare literature databases were searched using key terms like telemedicine, follow-up, questionnaire, survey, satisfaction, patient satisfaction, evaluation, post-operative, pediatrics, e-health, and telehealth. After extensively reviewing the literature, the most beneficial evaluation tool detected for my project was a questionnaire using Likert scale items. The outcomes of this search revealed 8 articles that contained the satisfaction questions used in previous telemedicine studies. It also exposed many additional articles that appeared to be highly relevant to my evaluation process and project. Within these encountered questionnaires, only 2 were previously tested for validity and reliability. With the initial assessment of all the applicable questions, it was identified that 58 questions had significance for my evaluation. After deleting repetitive, provider-focused, and patient condition type questions, the questionnaire was reduced to 16 satisfaction questions. These questions were slightly modified to contain specific wording for this particular project. These questions will identify 16 concepts which include satisfaction, ease of use, manageability, effectiveness, user-friendliness, assessment, privacy, virtual to in-person comparison, convenience, time efficiency, acceptability, beneficial, comfort, devotion, improved satisfaction, and valuable. Added to the survey were 10 anonymous demographic questions determined to be relevant from the literature search. This questionnaire was reviewed, revised, and accepted by my DMP project committee. The project proposal, design, and questionnaire is submitted to the UCIRB for review of appropriateness and patient safety. The third step is data collection. Over the course of the summer and fall of 2016, the normal workflow follow-up calls will be made by the APPs through either video phone or telephone, depending on the preference of the patient's guardians. 1 to 2 days after the follow-up call occurs, the evidence-based questionnaire from the literature will be emailed to the guardians of the patients. This email will contain a web link to surveymonkey.com for anonymous completion of the questionnaire. 2 additional email reminders will be sent weekly to the guardians regardless of completion status, reminding them of the survey response opportunity. 8 email reminders over the course of this project will be sent to the APPs, reminding and encouraging them to explain to the families at the time of hospital discharge this process and emphasize the importance of filling out the future emailed survey. A process evaluation audit will occur within the first 2 weeks of implementation to assess the quality of the program execution. The 4th step is analysis. At this step, an effect evaluation will be performed by compiling and organizing the data obtained from the survey and perform statistical analyses comparing the response between video phone and telephone satisfaction scores. The organized data will be analyzed with a 2-tailed t-test, Mann-Whitney-Wilcoxon test, and f-tests. At this point, the numerical data will need to be interpreted and judged. My recommendations will be determined by weighing the benefits, detriments, costs, and feasibility within the possible expansion or reduction of the telemedicine program at Children's. The final step is decision making. Once the data is interpreted and my recommendations are organized, I will present the findings of this project to the key stakeholders. These stakeholders include management within the Division of Telemedicine, the APP's management, the surgeons, and the Liberty Campus management. Once the data and my recommendations are given, it then becomes the stakeholders' responsibility to make the final decision of either expanding the telemedicine program, which would require an additional quality improvement plan, do, study, act cycle, or reduce the program altogether. The data in the project will then be disseminated to the UC DNP stakeholders through posters and assignments. Also, a manuscript of these findings will be submitted for publication in peer-reviewed journals. Like we talked about in the needs assessment portion of this presentation, pediatric healthcare reimbursements are transitioning to the value-based payment model like the adult world has done. Part of the adult reimbursement for services rendered at hospitals are based on the inpatient value-based purchasing program rendered through Hospital Consumer Assessment of Healthcare Providers and Systems, more commonly known as HCAP surveys. Pediatric hospitals are in the process of implementing a similar program designed for measuring patient perception of their experience in the hospital called Child HCAP surveys. These satisfaction survey scores will affect reimbursement rates for pediatric hospitals services that are rendered. After reviewing the literature, it was noted in multiple studies that care quality improvement increased because of measuring patient satisfaction. Albria and Al-Balushi noted, patients' evaluation of care is a realistic tool to provide opportunity for improvement, enhance strategic decision-making, reduce costs, meet patients' expectations, frame strategies for effective management, monitor healthcare performance of health plans, and provide benchmarking across the healthcare institutions. Knowing our patient satisfaction scores pertaining to telemedicine will allow us to perform additional quality improvement projects with the hopes of increasing patient satisfaction even more. Therefore, this evidence-based telemedicine project could be used to reduce costs by decreasing additional postoperative clinic visits and office call-ins. It could increase the access of care by allowing faster provider assessment through these technologies. It can provide better health outcomes for our patient populations. This survey will allow us to find correlations between demographics and the patient satisfaction scores, thus permitting us to individualize postoperative care. Additionally, this satisfaction assessment project could be the stepping stone for a future low-acuity post-surgical telemedicine follow-up program driven by nurse practitioners. This would replace the post-operative clinic follow-up with a surgeon, thus allowing more new visit appointments to be seen. Here is a list of my references. I hope you enjoyed my presentation.